Hi, I'm Dr. Bob Willicks. I'm the Chief Medical Officer for Cenegenics Medical Institute and the CEO and Chief Medical Officer of Cenegenics Boca Raton. Today I'm here to introduce the Heart Disease and Stroke Prevention Program with my friend and guest, Dr. Cesar Pellerano. Cesar, tell them who you are.
Thank you, Bob. My name is Cesar Pellerano. I'm a preventive cardiologist in Miami, Florida, and I am the Chief Medical Officer of Cenegenics Miami.
We are here to introduce to the public the Heart Disease and Stroke Prevention Program that Cenegenics has embarked on to prevent deaths from cardiovascular disease and stroke. And I'm going to ask Cesar to explain why this program is so important.
This program is important because cardiovascular disease, that is heart attacks and strokes, is the #1 cause of death in this country. And that applies to both men and women. By using this program, we're going to be able to detect and prevent cardiovascular disease in all of our patients.
So the uniqueness is that we're now taking a direct approach to identify those people who are at risk of developing or those people who have heart disease and or the risk of stroke. And we're going to determine what their programs will be based on their risk factors. And I'm going to ask again Cesar to talk about the blood work that we're going to start with, which is again very unique because it identifies genetic markers. So tell them what the 3 genetic markers or 4 genetic markers are.
That is correct. The blood work that we use in Cenegenics is the most advanced blood work that is available today. We're able to identify genetic markers such as KIF6, ApoE, and 9p21, which is for early heart attack, as well as inflammatory markers such as myeloperoxidase, C-reactive protein, and the plaque test. And these are tests that are not employed by every physician out there. In addition, by using the advanced lipid panels that we have, we're able to break down the cholesterol into the actual particles that are going to be causing the heart disease and strokes in our patients. Once we identify these markers and once we identify what these particles are, we can then treat our patients accordingly and prevent the cardiovascular disease.
So as a cardiovascular surgeon and as a cardiologist, we're looking to identify first, what are your genetic risks? Do you have a gene that puts you at risk? Number 2, what is the breakdown of the fats? It's no longer okay to just know what your cholesterol and your good cholesterol, the HDL and the bad cholesterol. We're going to break those down into sub-fractions. And the third component is the inflammatory component, because we now know that one of the biggest risks to people is they don't know they have heart disease. Because of inflammation, vessels suddenly clot or a plaque erupts or bursts. And Cesar will explain, how does that happen? How does this plaque burst? What happens?
That is correct. Most people think that a clogged artery is actually a clot or an amount of cholesterol that is blocking the artery, like you see a blocked pipe. And that is actually not the case. What happens is these small particles in the cholesterol actually go through the artery wall, and the plaque starts forming inside the artery wall. Once that plaque starts getting bigger and bigger, it starts infringing upon the wall, and when it gets to a certain size, the plaque can burst. When that plaque breaks, what happens is a blood clot occurs and the artery will become totally occluded, and that becomes what causes the main cause for a heart attack or a stroke.
Yeah, what the really interesting thing is, the #1 sign or symptom of heart disease is death. You know, that's a horrible symptom. There's no warning sign. Not everybody gets chest pain or angina. Not every stroke patient has a warning that they're getting dizzy or they have loss of vision for a short period of time. Most of them occur suddenly, and they're often fatal. So these are the people that we're trying to identify. If we can lower the mortality rate from heart disease, we will have done something in medicine that hasn't been done for the last 100 years of medicine. Identify risk factors, modify lifestyle and other things, and decrease the mortality from two diseases, heart disease and stroke, which, as Cesar said, are the #1 killers in the United States. And the intervention, I'll let Cesar take there.
That is correct. In fact, like Dr. Willicks said, over a third of the time, the first symptom of cardiovascular disease is either death, a heart attack, or stroke. Because many times these are called the silent killers. There is no real warning. What we are doing here at Cenegenics is by identifying all of these markers, we are able to pinpoint to people how they're at risk from a genetic standpoint, how they're at risk from an inflammatory standpoint, and how they're at risk from a cholesterol or lipid standpoint. We can then take the appropriate interventions to prevent all of these things from causing the cardiovascular disease in our patients.
So we'll take medicinals when it's necessary. We'll take herbs and nutraceuticals. We will modify nutrition and lifestyles. According to your profile, everyone will be treated different. And for some people, it'll be a breath of fresh air. They don't have any genetic markers. Their lipids are broken down in a normal pattern, and they have no inflammatory markers. Well, they then know that's not a disease that they're at risk of. And for a lot of people who have a family history of heart disease or who have had minor cardiovascular events, they really want to know where they are and what their risks are. Our program is designed to treat anybody. What age do you think they could start at?
Everyone could be tested. I have tested people in my office for preventive cardiology as young as 15 and 16 because they are the children of parents who have been patients in my office, and either they have developed cardiovascular disease or their parents have developed cardiovascular disease. And it is extremely valuable for young people and anyone to know exactly what their risk is. That does not imply that you're going to be treated, that you're not going to be treated with medicines or you're going to be treated at all. But once you know that you're at risk, the one thing that everyone can do, because this is something that is universal for all our patients, is your modification of your lifestyle.
And remember the modifications that we at Cenegenics, it's a three-pronged approach. We first look at activity and fitness. We then look at hormone optimization when indicated. And then we look at other lifestyle changes, which include the medicinal herbs and vitamins and nutraceuticals. So we take a total body approach, and some of the patients in our heart disease and stroke prevention program are going to want to take advantage of our executive health profile and go through the whole program. So come and join us at Cenegenics for our heart disease and stroke prevention program. We're going to have another session in the future on the other test that we do that is not blood work related, but it's called an intimal medial thickness, which is done with a machine, and we're going to go over that at another time. So please come and call Cenegenics and begin your quest for better health with avoidance of cardiovascular disease and strokes.